What is the best treatment option for your mole? Well, that very much depends on what the mole looks like, how it's been behaving, how it's been evolving over time, your reasons for wanting it removed, as well as individual patient factors. If, for example, you have a mole that's been there for years and years with no changes, no symptoms, is raised and protruding above the skin, and doesn't appear at all suspicious during examination under magnification, then treating it with a shave excision is a really great way to instantly get rid of the bumpiness, which is normally what we see and notice, create a wound that's as superficial as possible to minimize surgical risks, while still allowing us to send that sample of mole off for testing just to be on the safe side. The slight downside is that we are leaving a little bit of mole behind, so there is a risk of recurrence there. Though it is highly unlikely that the mole would ever return in its full glory. If we do see a recurrence, is that a little bit of that pigment bubbles to the surface, so it looks like a little bit of freckling where the mole used to sit, and that can easily be dealt with down the line. If, on the other hand, you have a mole that's flat, or very deeply pigmented, or that has in any way behaved suspiciously, or that looks abnormal under magnification, these kind of moles need to be fully excised with a little margin of normal skin around and normal tissue underneath, so that a full three-dimensional snapshot can be assessed under the microscope in order to provide a definitive diagnosis and to help plan future management. Full excisions are the most definitive way to remove a mole, but it does leave a proper straight line or linear scar and does involve the use of stitches, which for cosmetic mole removal can be a little bit off-putting to some. Other factors to consider are each patient's individual scarring history, the location of the mole, scar preference, as some people prefer a straight line scar to a patchy scar and vice versa, whether you're able to factor the necessary downtime, and also things like lifestyle factors. And so it's quite a nuanced conversation, which means that during your mole removal assessment, all of these factors will be discussed so that where multiple treatment options are suitable for you, we can come up with the best plan to ensure safe removal, minimizing surgical risk as much as possible, and giving you the best possible scar in the long term.